Good morning and good afternoon, everyone. Hope you're doing well today. Thank you for tuning into our webinar. We will get started in just about a minute or two. We're going to give folks a little bit of time to log in and get settled. But for those of you who are here already, please familiarize yourself with the chat box and the Q&A box and warm up those fingers by introducing yourself in the chat box and tell us where you're tuning in from. And if you'd like to be able to chat to everyone, please select everyone rather than just panelists in the drop-down menu with the chat box. So, great. We've got Nebraska, Florida, Washington, California. Wow, we've got folks tuning in Pennsylvania, Utah, Georgia. Thank you all so much for joining us today for this very important topic. And I hope those of you out west and in the Northwest are staying safe and healthy with all the fires that are happening out there. New Jersey, great. All right, well, looks like we've got lots of folks ready to go. So we're gonna go ahead and get started with the webinar today. Thank you again for joining us for today's National Conference of State Legislatures webinar, Children's Mental Health and Learning, Assessing COVID-19 Impacts and Looking Ahead. Today's webinar is hosted by NCSL's Health and Human Services and Education Committees. And we'd also like to thank the Health Resources and Services Administration's Maternal and Child Health Bureau for their support. Before I introduce our moderator, I want to review just a few housekeeping items. Today's webinar is a platform for information exchange and engagement. So over the next 60 minutes, we encourage participation through our chat and Q&A boxes. The Q&A box allows upvoting, so please ask questions for today's speakers using our Q&A option. You can use the chat box for general questions regarding today's webinar or to connect with other attendees. To familiarize yourself, if you're just joining us now, please put in where you're joining from today. We'll hold formal Q&A after our presenters are finished. Today's webinar is being recorded and will be available on NCSL's website, along with a PDF of the slides within the week. Now that housekeeping is out of the way, let's get to why we're here today. I'd like to introduce our moderator for the session, Representative Rena Moran from Minnesota District 65A. Among other roles, Representative Moran is the chair of the Minnesota House Ways and Means Committee. She currently serves as vice chair of NCSL's Health and Human Services Committee, and her legislative focus areas include child welfare, education, housing, and economic opportunity. Thank you, Representative Moran, for moderating this webinar, and I'll let you take it over.
Thank you so much, Kai. And hello and welcome everyone to our webinar today. And I want to really want to thank you for the invitation to be a part of such an important subject area, especially after and for some during COVID-19. As many of us know, COVID-19 brought significant changes to in-person learning and access to home-based services for students across the U.S., significantly impacting children and youth mental health and well-being. During this webinar, experts will provide an overview of how the pandemic may have affected children, highlight the roles that communities and schools can play to support recovery, and discuss state legislative trends. We have three awesome guests with us today that I am so excited to introduce to you. Joining us today are Dr. Philip Fisher, Alden Rivera, and Dr. Sharon Hoover. For full speaker bios, please see the attached documents in the chat box. So first, we have up Dr. Philip Fisher. He's a professor of psychology at the University of Oregon and a founding director of the Center for Translational Neuroscience. He is also a senior fellow at the Center on the Developing Child and a member of the National Scientific Council on the Developing Child at Harvard. Dr. Fisher will provide an overview of findings on how the pandemic has affected children's mental health and learning, as well as relevant information from his broader research. Dr. Fisher, I want to thank you so much for joining us today. And now the floor is yours.
Thank you, Representative Moran, for that nice introduction. And I want to also thank NCSL for inviting me to present. Let me just get my slideshow up and running. It was great to see people connecting up to the Zoom call from all over the country. Really a pleasure to have this kind of national audience, especially from state legislatures, where so much of the decision-making and policy with respect to young families with young children is going to be happening over the next immediate period of time. I'm going to be sharing information from a set of surveys that we started doing in April of 2020, right at the kind of the beginning of when the pandemic was beginning to take hold, and has continued up through the present. And really what we see these as more than anything is ways to amplify the needs of households and providers in the lives of young children, to understand what families have been going through, what the childcare workforce has been going through, and what they're going to continue to need as we move through and beyond, hopefully, this pandemic. So first and foremost, a little bit about the surveys. We began the household survey, as I mentioned, in April of 2020. This is a national survey of households with at least one child aged 5 or under. We administer the survey by smartphone or computer, so you need to have some kind of internet access, but not high speed or anything broadband like that. It's administered in English or Spanish. It takes about 15 minutes, and we pay people $5 every time they complete a survey. When the survey began, because so much was happening in the pandemic, we did the survey on a weekly basis. Since August of last year, we've been doing it twice a month. Every time the survey goes out, we get just over 1,000 households that participate in that survey. And as a result, some families take it multiple times, some just take it once, but to date we've had over 10,000 families take it in all 50 states. In addition to asking survey type questions, we've also been asking a series of open-ended questions that people can kind of fill in more general responses to. Things like, what are the biggest challenges your family is facing? What's helping the most? What would you like your policymakers or elected officials to know? We've really realized that this is a tremendous sounding board for people to be able to share their thoughts and their experiences, because we've had over 150,000 responses to the open-ended questions so far. So what does the survey focus on? Well, again, with households with a child age 5 and under, we're asking about how adults are doing in 4 specific areas: stress, depression, anxiety, and loneliness. We're asking about how children are doing in terms of their emotional well-being. We've asked a series of questions that focus on ability to pay for basic needs. So things like food, housing, utilities, and so forth. We've also asked a lot of questions of families about their childcare circumstances. And then lastly, we've asked about access to and participation in pediatric healthcare over the course of time. As I mentioned, we've also been surveying the childcare workforce. This began more recently, so in March of this past year of 2021. We do this survey also twice a month. We've been partnering with a number of organizations in order to recruit a really broad continuum of providers. So we don't just focus on center-based or licensed home-based care. We also look at family, friend, and neighbor and other more informal and unregulated forms of care. And again, similar structure, similar content, but also a number of workforce issues. And our numbers in that survey, as you can see, have begun to grow. We're now getting close to 2,000. So what are the data showing over time? Well, first of all, I think one of the things that stood out to us very clearly, and this will probably come as no surprise, is just the pervasiveness of difficulty that families have faced paying for basic needs. The magnitude of these issues is really what struck us. So at the beginning of our survey back in April, we found that about 1 in 4 families couldn't afford one form of basic need or more. So food or shelter, utilities, those kinds of things. At the height of the pandemic in last summer into the fall, we were actually at about 1 in 3 families, and that's begun to improve. And so our most recent surveys show that it's back down and has been pretty stable in 1 in 4 families. So it's beginning to look like it was previously. But again, I just want to point out, even though the graph shows a positive trend, that's still 1 in 4 families, which represents millions of children in the US whose family can't pay for basic needs. It's very clear related to this that debt has been a huge issue for families. So lots of debt that we see among our survey participants. More than half reported increased debt and not being able to pay bills or having unpaid bills. We see also how critical the stimulus payments that families have been receiving are in order to cover some of the overdue debt and unpaid bills that they have. We also, I want to be clear again, just in terms of the relief efforts, that families really have needed the relief that's occurred to date. So this was the 2020 stimulus payments and unemployment that was available in 2020. And you can see what proportion of households say that they were using those to pay for basic needs and other essentials. And we see a similar thing in terms of what families have been reporting more recently about how they plan to use the child tax credit money that they've now just started to receive, where a large portion of our households, especially when we look at lower income households, are saying that they're going to use it for basic needs, for unpaid bills and other essentials. When we move more towards the kind of higher income groups that will still be receiving the tax credit, we do see some saying that they're going to use it to put into savings as well. But really just how critical this relief is at this point in time, I think is really important. Related to these issues of material hardship has been the extent to which structural inequalities that we saw before the pandemic in terms of race and ethnicity and things like family structure really widened tremendously during the pandemic. So you may remember I mentioned that about 30% of households at the height of the pandemic were reporting they couldn't pay for basic needs. When you look at Black, Latinx, and single parent households, it's actually double that number. So about 60% or slightly above were saying that they didn't have enough money for basic needs. And what you can see by these dark green shadings on these bars is that those are families that reported that they couldn't pay for as many as 3 areas of basic needs, so really struggling financially. And one of the things that was particularly noteworthy in our data among Black and Latinx households were how many families were reporting that they couldn't make ends meet who before the pandemic were middle and upper income. So really these issues of the wealth gap among households of color is something that we've seen really illustrated in our data in terms of how much difficulty even people who had more prosperity before the pandemic have been doing during the pandemic. One of the reasons this is so important to us, since we do a lot of research on child well-being and early childhood kind of experiences, is because we've seen a direct link in our data between the amount of financial difficulty that parents are having and the extent to which then subsequently the adults in the household are reporting distress. And then after that, when we follow families over time, how much that's passed along to children. So we really see what we've called this chain reaction of hardship that starts with not having enough money. That proves upsetting to adults, not surprisingly, and then the adults are passing that along to children, also not surprisingly. We've also found another factor that's, I think, quite important to recognize during the pandemic, which is how much unpredictability, in addition to just hardship, is really exacerbating the challenges that families are facing. So we've done a lot of work on this in the past before the pandemic, and many other researchers have as well, that really one form of so-called toxic stress is not being able to predict what's coming up, having really unreliable schedules and lots of sort of unpredictable things happening clearly seem to have a negative effect on children's brain and biological development. And actually, one of the things that was recently published by some other researchers is that where families have had more predictability, it's actually proven to be sort of a buffer against those sorts of stresses. So unpredictability, in addition to overall levels of hardship paying for basic needs, seems to be making things worse. One of the things that we've seen about how this is operating is unpredictability and hardship really do seem to be taking a toll to the extent that they're disrupting family routines. And I think that's important, not just from that it's hard to maintain a regular schedule and that's taking its toll when you're having all of these difficulties, but also it suggests things that communities and policies could potentially do in terms of helping to support families to be able to sustain routines in the context of the pandemic as one way to buffer against some of these effects. So the second finding that I want to talk about briefly is just the extent to which providers, the early childhood workforce, has been struggling in addition to what families have been going through during the pandemic. And we just put out a fact sheet on this that I'd be happy to share if you just send me a message after this webinar. But we see that 1 in 4 providers that are in our survey report that they don't just do childcare, but that they have at least one other job, and many have several other jobs. And when we look at Black and Latinx early childhood providers, we see that that number is even higher. We found that more than 40% say that providing care only accounts for half or less of their income. And we also see that the rates of material hardship, the rates of difficulty paying for basic needs, are higher currently. So this is current data for providers than they are for families. So especially for family, friend, and neighbor care, where we see almost half say that they have at least one area where they can't pay for basic needs, but also in these other 2 groups, center-based and home-based care, 1 in 3, which was about what we saw at the height of the pandemic, 1 in 3 is still having difficulty in the current context. Providers are paying for basic needs. Again, just as we saw with parents, we see that the more hardships people are having, the more emotional distress they're experiencing. And so when you think about how much we rely on the early childhood workforce to provide warm, nurturing, reliable care for children, but these are the circumstances that they're paying or that they're facing, you have to wonder about whether we're adequately providing what the workforce needs in order to do what they need to do. And similarly, we see here when we look at specific subgroups, so these are the different categories of providers that we've been sampling, that center-based teachers and family, friend, and neighbor are reporting difficulties not just with kind of the basics, but in a whole bunch of additional areas, including not having enough money for mortgage, worried about their utilities being turned off, worried about evictions and mortgage foreclosures, et cetera. So when we kind of begin to think about how do we make use of this information and what should the recommendations be in terms of policies that we need, first of all, it's very clear to us that the financial support that's coming through things like the child tax credit will really continue to be essential for helping families with young children be able to make ends meet. We also are very clear that it's not just about kind of getting enough to people, but creating stability and predictability in all of these areas that families depend on: financial, housing, access to food, childcare, access to healthcare. The more predictability and reliability we can create in these systems, the more we're going to see things improve for families. We clearly see that these racial and other inequality gaps that existed and have widened really need to be addressed. One of the areas where we see the most attention being needed is within the childcare system. And then I think the other thing is that what we've seen in our data suggests that to the extent that families are able to come together and communities are able to come together in order to create the kinds of predictable and warm and nurturing environments for kids, that's really where we see the greatest sort of offset or mitigation of a lot of the challenges that families have been facing. So I just want to end, and I put my email contact in here. I want people to know that we have actually created fact sheets that are on a state-by-state basis that provide information about what we're finding in specific areas. The first set to come out are on childcare. If you're interested in getting a fact sheet from your state, from the data that we've been collecting, please feel free to send me an email and I'd be happy to send it to you. So thanks very much. And also you'll be able to see that we have a web page and a variety of results that you can look for on that web page. So I'll stop sharing there and turn things back over to Representative Moran.
All right, well, thank you so much, Dr. Fisher. What a great presentation and so timely. For those who are attending, what we're going to do, the process will be that we will hear from the three speakers and then we will open it up for questions. So please, I know sometimes, we're in the moment and we want to ask the questions as the speakers are speaking, but please just jot down your questions so that you don't forget, and I promise we'll get to them. Thank you. So next up, we have Autumn Rivera. So Autumn is a policy analysis with NCSL education program, where she focuses on after school, summer learning, school climate, and bullying, along with student mental health and social emotional learning. Autumn will provide examples of state actions to address children's mental health and well-being in educational settings. Autumn, I want to thank you so much for joining us today, and I'm going to turn it over to you. The floor is yours.
Thanks, Representative. Okay, I'm going to go ahead and share my screen. There, we should be able to see it. Hi, everyone. Like she said, my name is Autumn Rivera, and I'm a policy associate with NCSL's education program. Today, I'm going to quickly go over some of the policy trends seen throughout states in student mental health legislation. One of the observed state trends is states connecting physical and mental health through mental health curriculum. For example, in 2019, Maine enacted legislation that requires that health education curricula in K through 12 address the relationship between physical and mental health to reduce the stigma and enhance students' understandings of attitudes towards and behaviors relating to student mental health. Additionally, in 2020, South Carolina enacted House Bill 3257, which requires the state educational agencies to revise existing age-appropriate standards and concepts that address mental, emotional, and social health. This also relates to coursework and adds additional requirements for 7th through 9th grade students. As suicide continues to be a leading cause of death for youth, many states have turned to policies aimed to prevent student suicide. These include promoting awareness, intervention plans, providing support services, requiring professional development, and more. With the passing of legislation in 2019, California now requires that local education agencies, or LEAs, adopt and update a policy for students grade 1 through 6 on suicide prevention that specifically addresses the needs of high-risk groups. This bill requires that suicide prevention policies to be age appropriate and delivered and discussed sensitively to the needs of young people. Illinois focused on teacher in-service trainings with Senate Bill 1731 in 2019. This legislation requires that teacher in-service training program focuses on the warning signs of mental illnesses and suicidal behaviors in youth and must use evidence-based training to educate the participants. In 2019, Oregon enacted Senate Bill 52, which requires school districts to develop comprehensive plans on suicide prevention for K through 12 students. The plans must include procedures for suicide prevention, intervention, and activities that promote healing after a suicide. Over the years, states have enacted legislation requiring staff training and professional development around trauma-informed care. Indiana requires that applicants for a teacher's license must provide evidence that they have completed training in trauma-informed instruction through the passing of Senate Bill 205 in 2021. Similarly, back in 2019, Oklahoma enacted House Bill 1905, which requires teacher candidates in the teacher preparation system to study trauma-informed responsive instruction. Research has shown that mental health screenings allow for early identification and intervention for youth. This is reflected through policy trends over the years. For example, Tennessee enacted Senate Bill 7019 in 2020, which requires LEAs to develop a plan to conduct mental and behavioral health screenings for all students K through 8 during the 2021-22 school year. These screenings aim to evaluate the impact the COVID-19 pandemic had on students' mental and behavioral health. In 2020, Utah enacted House Bill 323, which allows for the implementation of an evidence-based mental health screening program. It also sets standards for participating LEAs to implement approved mental health screening programs for participating students. States have also taken a look at policies around staffing ratios for professionals in schools. Virginia passed legislation in 2020, which requires local school boards to employ school counselors with a predetermined ratio. The ratio differs between elementary, middle, and high school level students, with the most concentrated number being in the high school level. Maryland required each local school system to submit an interim report on the ratio of students to psychologists in each school, strategies to increase the number of psychologists, and strategies to increase retention with House Bill 844 in 2019. Another observed trend is policies focusing on providing school-based mental health programs and services. For example, Safe to Tell Colorado was initially founded as a nonprofit. Now it is incorporated to develop a statewide anonymous reporting tool available 24 hours a day. With the passing of House Bill 20-1113 in 2020, they made enhancements to the Safe to Tell program. These include training law enforcement dispatch centers, school districts, individual schools, and other entities on appropriate awareness and response to Safe to Tell tips, and providing Safe to Tell awareness and educational materials to all elementary and secondary schools in Colorado. In 2020, Iowa school districts and schools, with the passing of Senate Bill 2261, are now available to provide behavioral health services via telehealth to students on school premises. Washington required the development of comprehensive school counseling programs with the passing of Senate Bill 5030 in 2021. This requires that by the 2022-23 school year, each school district will have developed and implemented a written plan for a comprehensive school counseling program that's regularly updated. A newer trend we've seen is states adding mental health to a list of valid reasons to be absent for school. Nevada Senate Bill 249, passed in 2021, provides that a qualified mental health professional or behavioral health professional can provide a certificate to excuse a pupil from attendance. In 2020, Maine enacted legislation that includes student absences for mental health or behavioral health needs as an excusable absence. In 2020, Colorado also enacted legislation that requires the school district's written policy for attendance requirements to include a policy for excused absences for behavioral health concerns. Work groups, pilot programs, and commissions have also been utilized in many states. In 2021, Hawaii enacted legislation which requests the state education agencies to convene a working group to create a model statewide school policy on student suicide prevention, intervention, and postvention in K through 12. New Hampshire used House Bill 131 in 2019 to establish a commission to develop and promote mental health programs and behavioral wellness programs in K through 12. In 2020, Wisconsin enacted legislation which creates a school-based mental health consultation pilot program. This will assist participating school-based providers in providing enhanced care to students with mental health care needs, to provide referral support for those students, and to provide additional services. Overall, there are many ways policymakers approach student mental health legislation. These were just a few examples of how states have done this in the most recent years. Feel free to reach out if you have any questions or comments for me. With that, I'll pass it back to Representative Moran. Thank you.
Well, thank you, Autumn. It is really important for us as legislators to know the trends of what is moving in different states. So really great information. Thank you for that. Okay, so next up we have Dr. Sharon Hoover. Dr. Hoover is a licensed clinical psychologist and a professor at the University of Maryland School of Medicine, Division of Child and Adolescent Psychiatry. She is also co-director of the National Center for School Mental Health. She's leading national efforts to support states, districts, and schools adopt a national performance standards of comprehensive school mental health system. Dr. Hoover will discuss children's mental and social emotional health and the roles that schools and communities can play in supporting children's well-being, something that we are all very much concerned about. Dr. Hoover, I want to thank you so much for joining us today, and I'm going to turn it over to you.
Thank you so much. Thank you, Representative Moran. I appreciate it. And thank you so much to NCSL for inviting me to share some thoughts today. As Representative Moran mentioned, I'll be speaking a bit about children's mental health and the impact of COVID-19 on children and their well-being. And I'll also speak to some of the things that states are doing specifically in the space of school mental health to support children's mental health right now. I did stick some links into the chat box. I'll be referencing some links throughout our time together today. So wanted you to have access to those. And I also saw in the chat box that the slides will be made available to everybody. I know there's been some questions about that. So thank you again for the welcome. Let me share first with you all where you can find the work of our centers. First, our National Center for School Mental Health can be found at schoolmentalhealth.org. And for over 25 years now, we've been charged by the U.S. Department of Health and Human Services, and specifically HRSA, with strengthening policies and programs in school mental health to improve learning and promote success for America's youth. And I'd also encourage you to visit a more recently SAMHSA-funded center that our team leads as part of the National Child Traumatic Stress Network. And this center, the National Center for Safe Supportive Schools, focuses on the intersection of comprehensive school mental health systems, cultural responsiveness and equity, and trauma-informed healing-centered policies and practices. So much of what I'll share today comes out of the work of both of these centers. So again, my goal with you today is really just to briefly review some of the mental health impact of COVID on students, families, and educators. That we heard a great review of that from Dr. Fisher. So I'll just do a light touch on that. And then I'll spend most of my time just considering how we can respond and how schools are responding, especially as we are reintegrating students into their social and learning settings this summer and fall. So in the context of tremendous stress and loss and community and family burden that we heard about from Dr. Fisher, it's not surprising at all that we would see an impact on young people's mental health. And we know these impacts cut across all communities, but are likely most impacting communities hit the hardest by COVID, including communities of color and those with inequitable access to healthcare and education. And social media and news headlines, as you can see here, have been full of speculation and statements about children's mental health worsening. And certainly we want to be mindful, watchful, proactive around the impact of COVID on youth mental health. But we also have some concerns about the sensationalization of children's mental health in the media, especially around suicidality. So we want to be careful not to do more harm than good, and really look to the data carefully to understand impact and responsible and appropriate response. So early in the pandemic, there were a number of surveys of young people that did provide some insight into the mental health status and experience of young people. This survey, for example, which was conducted in late April, early May of 2020, captured some experiences that, again, not surprisingly, indicated that many adolescents were feeling more disconnected from peers and adults than they had pre-pandemic. And many were reporting an increase in sleep loss due to worry, feeling unhappy or depressed, feeling constantly under strain, and loss of confidence in themselves. We do now have more recent data indicating that young people are in fact experiencing negative mental health impact, for example, and many states are increasingly aware of this, that emergency department visits for mental health concerns are up for children and adolescents. And many parents, about a quarter of parents, are reporting that their children's mental health is worse than pre-pandemic. And parents and educators, two of the most salient groups of adults in our young people's lives, are also under tremendous stress. And as Dr. Fisher noted, that chain between parental distress, but we also know it's relevant for educator distress, really does lead to child distress. So for parents, parents are reporting significantly higher levels of stress related to COVID than non-parents, with about 70% of parents reporting that distance learning for their children has been a major source of parenting stress. And for educators, the layers of complexity and burden of learning this new learning landscape really have resulted in increased levels of stress and burden, according to the data, with national surveys indicating increases in teachers leaving or at least considering leaving the field. So given this well-documented impact of COVID on the well-being of our students, our families, our educators, where do we go from here? How do we address the anxiety, the fears, the loss, the inequities that have been exacerbated during COVID, while simultaneously fostering hope and resilience in our young people? So I'm going to talk about one avenue for addressing this. So we know that to address the mental health needs of students, families, and educators, it's really essential that all schools have a robust, comprehensive school mental health system. I recognize that some of your states already have well-established school mental health systems. I've worked with many after seeing folks identify themselves in the chat box. I've worked with many of your states or local communities. Our centers have worked with many of you and are aware of the good work happening. Other states or local communities may have less infrastructure for school mental health at this point. So if you're seeking an overview of school mental health systems, the resource here that I linked to earlier in the chat box may be helpful to you. We worked with several of our federal and national and state and local partners to develop guidance that document really the details of the why, the what, the how of school mental health, including specific examples of how states like North Carolina, Wisconsin, Colorado have established state school mental health frameworks and sustainable funding mechanisms. So I encourage you to check that out. Let me briefly walk through what we believe every school should have as we reintegrate students at this moment in time, and some of the legislation that Autumn referred to speak to some of these very directly. So a guiding framework of comprehensive school mental health systems is this multi-tiered system of supports in schools. And the idea is that mental health in schools must be supported by this foundation of family, youth, school, community partnerships, and professional development. And then supports are provided to all students at Tier 1 to promote mental health universally. And then more intensive supports are increasingly provided based on identified needs and strengths of students. There are a lot of universal strategies with strong evidence, and based on the data that does exist, we would argue that each of the 5 areas you see here should be in every community's plan for creating healthy and safe schools. And again, we're seeing some state and local action legislation to support these. So first, assessing and improving school climate. Second, ensuring that school policies and practices are culturally responsive and trauma responsive. Third, schools must have a plan to promote staff well-being. While we're focused on student well-being, we have to simultaneously be focused on educator well-being and school staff well-being. Fourth, schools should be incorporating mental health literacy for school staff and students from K through 12. And then finally, states should adopt standards for social emotional learning, and every school really should have this in some way in their K through 12 curriculum. It's also essential as we move up our tiered system of support that schools provide intensive mental health supports for students who may benefit from mental health treatment directly in the school building. And sometimes folks will ask, well, wait, we have community mental health. Isn't that really the system that's in place for that? But what we know is that there's really solid evidence that not only do more youth initiate services when they're offered in schools, they're also much more likely to complete treatment when it's offered in schools than when it's offered in other community settings. You can see here one example of that. It was a study of trauma treatment services in Louisiana post Hurricanes Katrina and Rita, where over 90% of youth served in the school completed treatment as compared to about 15% of youth who were served in a community setting. So it's a 6-fold increase in treatment completion. So what can states do to make this happen? First, some states have already done. It can be helpful to districts when a state establishes a state-specific comprehensive school mental health system framework, as you can see here from Wisconsin and Colorado. Second, states can support districts and schools in assessing the quality of their school mental health systems and engaging in continuous quality improvements according to national best practice standards. Thousands of schools and districts in every state are already engaged in this on the School Health Assessment and Performance Evaluation, or SHAPE system. This is a free online portal that was federally funded by HHS. Third, schools are a critical place to assess the well-being of our young people. You saw Autumn speak to some of the mental health screening or mental health well-being check-in legislation happening. And just as we're increasingly conducting well child visits in school-based health centers across the nation, we are increasingly seeing schools establishing what some call well-being check-ins at school, or screening to assess for things like anxiety and depression, but also for things like school connectedness and overall well-being. Fourth, to promote well-being of all students, we must establish, as I've already alluded to, state standards for incorporating social emotional learning and mental health literacy into school curricula so that students can gain the social emotional competencies to be successful, and so that they learn about how to achieve positive mental health and seek help when needed. This can't really just be devoted to 1 hour of learning in 9th grade health class, right? It needs to be woven into the curriculum from K through 12. One recent resource we wanted to share that came out in the last couple of weeks as a free online mental health literacy course for every educator in the nation. This was just released in the past month with federal support from SAMHSA. Finally, we must provide a robust school mental health staff array in every school. And this really should reflect a combination of both school employed and community employed to leverage the education and mental health resources. States, districts, and schools often grapple with how to strategically staff a full continuum of mental health supports and services, and they sometimes exclusively rely on either schools or community partners. And one thing we know is that this strategy fails to really leverage the strengths and resources of each system, education and health, behavioral health, and may lead to kind of siloed or fragmented support. So a document that, again, I shared a link to in the chat box that was authored by the National Association of School Psychologists and our National Center for School Mental Health. It provides an overview of the key elements of how you can effectively foster these school community partnerships and action steps for states and districts and communities to foster these effective collaborations. And as we say here, when it comes to school employed and community partners supporting school mental health, it is not either or, it is both and. And I wanted to close just with some guidance around the funding that is available right now in the context of COVID relief and recovery to support some of what we just spoke about in terms of supporting student and staff well-being. As you all are likely aware, in 2020 and 21, Congress passed 3 stimulus bills that provide over $190 billion to the Elementary and Secondary Emergency Education Relief, or ESSER fund. And this funding to state and education agencies, state education and local education agencies rather, represents a historic opportunity to support the conditions of learning and address equities in education. And we know that there is a wide range of needs that can and should be addressed with ESSER funds, but it really is critical that states and school districts invest resources in efforts that support student and staff well-being and connection. This work is more important than ever, given what we just spoke to about student and staff mental health needs as a result of the pandemic. And the cover of the guidance document that you just saw is a guidance that was recently released by the Council of Chief State School Officers in partnership with our National Center for School Mental Health and the Healthy Schools campaign. The guidance provides several examples of allowable uses of COVID relief funds and Medicaid for SEAs, state education agencies, to support student and staff well-being. And the examples really focus on investments that support capacity building and infrastructure while employing best practices and sustainable funding strategies. The list of examples that are provided is quite detailed in the document. It's not exhaustive, but it hopefully helps to provide a roadmap for states and local communities when they think about how to best invest ESSER funds to support student and staff well-being. And they fall within the 6 categories that you see here. And there's also within that guidance document, guidance for local education agencies and authorities to fund across multi-tiered systems of support. So we go into some detail around how LEAs can use ESSER funds to support Tier 1 and Tiers 2 and 3 supports for student mental health. So I encourage you to check out that guidance and to be thinking really about how to effectively leverage ESSER funds, but also Medicaid for a sustainable support system for student mental health. Feel encouraged to reach out to me directly and to our centers at schoolmentalhealth.org and ncs3.org for more information and support as you navigate these complex times. Thank you so much, and I will turn it back over to Representative Moran.
Well, I want to thank you, Dr. Hoover. You have just shared a wealth of information, as so has the other 2 presenters. And I know as I was listening and trying to take notes, feeling a little bit overwhelmed, knowing that this information will be, I believe, shared on the NCSL site, because it is just invaluable information. So I really do appreciate the presentation. So now we would take questions from the audience. We have a few questions that have already been submitted, but don't forget, if you have a question for our speakers, please type in the Q&A box. Let's see here. As a reminder, this webinar is being recorded, and the recording and slides will be available, as I just stated, on the NCSL website in approximately 1 week. Okay, so our first questions to the presenters, and anyone can respond to this question. So Dr. Hoover, you mentioned the opportunity around the federal COVID relief dollars. What are some other measures that state legislators who want to support student mental health might consider?
Yeah, so good question. There are certainly opportunities within COVID relief funds to support student mental health, but this is not a new issue, nor is school mental health a new solution. And many states, as I indicated, have been adopting or developing standards for effective school mental health and figuring out ways within their current budgets to support student mental health. Some of the legislative actions that Autumn referred to were happening prior to COVID. And so I would first suggest that states go to some of those activities that have already been happening in states. Folks are using Medicaid funds, both education funds that are coming down. They're drawing down Medicaid funds through the education sector, and also some of the funding from the mental health or behavioral health systems to support school mental health. We have a state policy map that I'll stick into the chat box that speaks to how some states are leveraging funding mechanisms to support all of the different tiers of behavioral health support in schools. But perhaps Autumn or Dr. Fisher want to jump in on this as well.
Okay, Dr. Fisher?
I don't really have much to add. I really think
Okay.
that what Dr. Hoover said was really comprehensive. So happy to move on to other questions. That was a very good answer.
Okay, well, Dr. Fisher, Dr. Hoover, I have another question here.
Sure.
Can you tell us about how the pandemic impacted caregivers? And I know we talked about that. Can you extend on that a little bit? And child care providers or teachers, and what that means for children's health?
I can start with that a little bit. I think that it's very clear, as I was saying, that a lot of the financial circumstances that people have been facing have sort of been a root cause of a lot of the emotional difficulties that people are having. But just from a sort of broader scientific perspective, one of the things that's really clear, we've done a lot of work in this area, and there are a number of others who have, that children really rely on, especially young children, on adults to help buffer them from the effects of stress in their environments. When young children are born, as I'm sure many of you know, they don't have the sort of biological capability to regulate their own systems, and they depend on parents and other significant adults in their lives to be able to do that. When those circumstances sort of persist over time, what ends up happening is that these biological stress response systems that aren't fully developed end up being on a high alert for prolonged periods. And that's where you begin to see some of these changes that people refer to as toxic stress, where you're really seeing kind of compromised, potentially cognitive development and other areas of health, risk for obesity and diabetes, heart disease, all kinds of things across the lifespan. It's not just when stress occurs. I want to be really clear. It's sort of the kind of stress that's chronic in the context of not having supportive adults who are able to help buffer. And I don't mean to like point a finger at parents or at providers in any way about this. I think what we can all relate to is that when you don't have enough food on the table, when you don't know if you're going to be evicted from your house or not, when your utility back payments are piling up, that those things are big distractors, and that it becomes harder to really be in the here and now and be as focused as would be optimal on what's going on with children in your life when those circumstances exist. So that's why as sort of developmental brain researchers, we've been very concerned about these circumstances persisting over the pandemic, because it's really sort of like the perfect storm of situations that can lead to these long-term effects. Let me just counterbalance that by saying families have done an amazing amount and have borne incredible, I mean, parents are really the unsung heroes of the pandemic in terms of how much they've covered their educational needs of their children while continuing to work, and really in which they continue to be able to still plug into their kids' lives. And I also think that a lot of the story is at this point unwritten, because we don't know whether the kinds of supports that are coming into play are going to help to mitigate some of these effects. So I think it really behooves everybody on this call to be thinking about what are state policies and what are community efforts that can be put in place, including in the schools, to really help with offsetting some of these effects, rather than think, well, the damage is done, there's nothing we can do. The question is, how soon can we, sort of step up and do the things that we know will make the biggest difference, like what Dr. Hoover was describing.
And if I could just piggyback on that for a moment, thinking about that K through 12 space and some of the things that we can do, certainly also in pre-K and post-secondary as well. What Dr. Fisher said about how hard families have worked and tried to really navigate, again, this very complex time. One of the things I think schools can do as we re-engage students and families is acknowledge and honor and celebrate how hard families have worked during this time. So not just kind of business as usual, but making space to really recognize what families have done during this time. And just to speak to the impact on teachers, again, there's plenty of data that shows that when you have teachers who are burned out and stressed, there is a direct impact on the students in their classroom with respect to not only the student stress, but also their academic performance. And so again, as we think about reintegrating students and how to support student well-being, I would say a first step in that has to be, what are we doing to support the educators who are going to be with them for several hours each day in terms of their well-being? And it can't just be person-centered approaches in the sense of we can't just be having, walking Wednesdays, yoga Tuesdays. Those are important, but it also has to be the structural components that really support educator well-being, giving them respite and decision-making power during the day, things like that.
Yeah, absolutely. Dr. Fisher, I was just thinking, I wrote down neurobiology of stress and looking at brain development. There's a lot of research and data around adverse childhood experiences,
Yes.
Which we call ACEs.
Yep.
Right, and the impacts and the long-term impacts that has on children who will one day become adults. And so for any speaker here, the question is, has the learning loss faced by children during the pandemic been studied? And then what may be the long-term effects, and what are schools and states doing or should be doing to support students now? To anyone.
I'll say really briefly, I think probably the other speakers can comment more specifically on what can be done. I can say for sure that there's been a lot of concern about learning loss during the pandemic. And I think in some instances, that concern is really well-founded. For sure, for parents that have been trying to balance work and their child's education, which is many parents, and we're hard pressed to be able to do so, and especially in the context of lower income households where there was much less access to kind of hybrid education. It was much more online only. Technology issues came into play. Those kinds of circumstances are going to exacerbate the kind of learning loss that might be seen in general. I think, as we've been saying, a lot of parents stepped up and did an amazing job doing what they needed to do to support online learning, to support and supplement their children's education. But the cards were kind of stacked against some parents in terms of, like, we have a local community here where there was one of these big fires last year, and the entire internet infrastructure was destroyed. And, so parents were driving miles to get to a local church that had the one source of broadband. And then there were 40 or 50 cars in the parking lot with families sitting in there for the day trying to help their kids access education. That's where we're going to see the biggest differences. And the other thing I just want to note is that social emotional learning loss is probably going to be as much of an issue to address as academic learning loss. That is, to the extent that kids were isolated, didn't have a lot of contact with peers outside of the family or adults outside of the family, the social emotional development needs to be addressed in addition to the academic development.
Absolutely. And for Autumn or Dr. Hoover, what may be the long-term effects and what are schools and states doing or should be doing to support students?
Autumn, do you want to jump in?
Mhm.
Okay, so I'll speak just quickly to it. So I think, as you know, Dr. Fisher mentioned in his presentation, we have yet to see the long-term effects, but we can anticipate, even from prior community traumas and from prior pandemics, that there will certainly be long-term effects, not only in terms of learning loss, but in terms of health and well-being of children and families from this type of kind of pervasive stressor and inequitable stressor, right? We know that certain communities are going to feel it different. In terms of what we can do, you know, my lane is mostly in this mental health and well-being space. And, you know, as Dr. Fisher said, I think we need to be attending to that just as much, if not more so in the early stages, so that we can ensure that young people are ready to come to the learning table. There's all sorts, a wealth of recommendations right now for what education agencies at local and state levels can and should be doing, and many are, right? So there's lots of summer tutoring programs, you know, all year schooling. So I don't necessarily know that it's helpful to get into an exhaustive list of that, but really to emphasize that we have to attend to the health and well-being of our young people as one of the answers. It can't just be, you know, if we provide more tutoring to everybody. The other piece is related to the inequities and even the pre-COVID existing inequities and just differences in communities in terms of access to learning and health and well-being. We can't try to approach this with a one-size-fits-all. I saw a comment in the chat box from Mary Kunesh around Native families having high levels of mental health issues, health disparities, historic trauma, low graduation rates. And, you know, we have to be considering how each community has fared during this time, but also what was the pre-existing kind of status of these communities and can we tailor approaches?
And I just was going to say that I noted Ashley Wallace, my colleague, put in our blog about learning, recovery, and re-engaging students, both social, emotionally, and academically. It also links to our webinar series on learning recovery. So check that out. We've got more resources and things there as well.
And I know, you know, the pandemic has really exposed the inequities that we see within learning and the impact that the pandemic has had on different families, diverse families. And I just want to you know, respond to the presentation. I can't remember who it was right now that talked about the culturally responsive, trauma responsive type of policies and practice that are needed in every state.
Yeah, I think it's critical that we think about these issues. And I want to note also that one of the primary ways that that child maltreatment has historically been identified is through the education system, that and the healthcare system, both of which were largely shut down in terms of the kinds of exposure that would allow kids who are really struggling around issues of maltreatment to be identified, to get the support, and for families to get the support. So I think it's another issue that we're going to need to continue to raise awareness of as things reopen.
Absolutely. You know, this type of conversations are, you know, so needed. They're so current. We know that, you know, this pandemic has had an impact on our students and on families and on providers and communities, right? And there's just so much more that I believe that we can and we should and that we need to continue to talk about. But unfortunately, we do not have much time left. And I just want to say for those who are on here, legislators, if you have any questions that we did not get to today, we will respond via email. So please send your questions. If you have information to share, please do that also. So as we get down to the 1 minute ending to our 2 o'clock time, we would like to extend a final thank you to our presenters, Dr. Hoover, Dr. Fisher, Autumn. Thank you so much for being here. for sharing your wisdom and your information with us. We really appreciate your time and your expertise, and each of you was able to provide. And so with that, I guess I should say goodbye. Is that okay, Kai?
Yes, thank you so much, everyone.
All right,
Hope you have
thank
a
you.
great rest of
And
your
Yeah.
day.
absolutely. Take care and be safe.